One of the things we've identified as kind of a barrier to people's employment in a big way, and this affects people who aren't not just homeless, but mostly poor folks in general. Not most poor folks, but mostly poor folks have a problem with their teeth, and we found that the lack of front teeth is a major barrier to employment for a lot of people who are homeless, and probably a lot of other people who are in houses but are low-wage earners. And there's a certain amount of discrimination when somebody doesn't have their front teeth, and yet, healthcare, and especially dental care at a discounted rate, is almost unheard of. I was at a free dentist thing this morning because I needed a tooth pulled, and being an activist with an unincorporated association doesn't pay a whole lot. So I went to this thing to get a tooth pulled, and I knew basically the first 60 people in the door were going to be the only ones to get any services. And when I left after making it through the door, there was probably about 200 people waiting for services, most of whom were not going to get any. And it's just a huge glaring gap in what we have. I mean, we literally have Americans walking around in pain with teeth they need pulled, and in pain all day long because they lack the funds to get it removed. I don't think that says a whole lot for our society, and it's one of those things that, what's the long-term dividends of this? We have a whole, the lack of dental care will in time, produce and contribute to a whole underclass of people that are basically unemployable. Right. Especially that as the service industry dominates the job market,
Right. Didn't you go there 2 hours early today?
Yeah, I got there 2 hours before the doors opened, and there had been people sitting in line all night to get their tooth pulled, and it seemed like the people that were in line all night were in horrible pain. And that's why, what motivated them to get up at 1 or 2 in the morning and go sit out for 6 hours to make sure you get free health care, some free dental work. And the doctors were pretty firm on basically a one-tooth policy. People would come in and be like, this one's abscess. They're like, which one's worse? Okay, we'll pull that one.
But it is kind of cool that these doctors, can you talk about those dentists and what was going on? Because I think this is something that we need to identify in communities. There are plenty of dentists in the world that make a lot of money. They could be stepping up and helping people out on the weekends.
Well, yeah,
there are a lot of people that have lost their homes to foreclosure.
Doing a free day quarterly. In this town there's a group coming together called the Good Samaritan Project that is getting a number of health professionals together to volunteer to serve low-income and homeless people. Right now it's kind of a mobile clinic. They set up in different places once a month, but they are looking for a building. The dream is eventually to have a place where anybody can walk in and receive health care, basically free or for very, very low charge. And it's something that has to happen. 200 years ago we had private firefighting departments, and they would only put out the fire if you had the firefighter department's emblem on your house. We kind of collectively realized that if we let this person's house burn, it's probably going to catch your neighbor's house on fire. So we came together to collectivize our fire protection. Illness and healthcare is the same thing. What dividends does it pay when you have 80 million people without health insurance who, when they get strep throat or bronchitis, they just live with it all winter because they don't have the money to go to a doctor? How many times are you going to get sick, even though you have health insurance, because a substantial part of our population has no insurance and aren't going to the doctors? This pays dividends. I mean, when people have strep and don't get it treated all winter, how many people do they infect? Chances are they're a low-wage worker and they work in the service industry handling your food. That person also is, people that go with untreated strep have a very high rate of dying of heart disease in their 40s and 50s. This lack of health care is killing people, and people in my generation, basically, when you're 30 and you have been living on your own since you're 18, you haven't seen a doctor since you're 18. Except for maybe a strep test or a physical before you're on the football team, or something small and specific. You don't have a family doctor. I don't have a family doctor. I don't even really know what I'd do if I had to go to the doctor. I'd probably go to the hospital. I mean, that's what it amounts to, honestly.
Yeah.
Where do I get a referral from? I don't even know. There's so many young people that work in the restaurant industry that are like me. They're like, doctor, what's that?
Yeah.
And it's getting bad. What dividends is that going to pay for our society?
It's going to cost us billions down the road.
How many lost man hours in productivity are there from the lack of health care?
Right.
My friend Ronnie was on the porch. He got fired. He was sick for 3 days. They told him to bring a doctor's note in. He said he doesn't have enough money to go to the doctors. And the employer was like, there's free clinics. There's not free clinics. So he's going to win his unemployment, obviously, for being fired for no fault of his own. It stands to, why do the rich people all think there's like a free clinic? Like, we have a Marillac clinic, but it takes a month to get a card if you're qualified, and then another month to get an appointment. Like, if you have an abscessed tooth, like, that doesn't work. And then the fee for it is almost as much as some of the cheaper dentists, like after going to the discount place, you know. The free community health care, it's not even free.
Right.
Same with the shelter. The shelter charges $2 a day. I forgot to mention that. During the summers, they charge people $2 a day, and then they co-support a campaign to discourage panhandling in town. And they have a rule at the shelter that if they see you panhandling on North Avenue near the shelter, you can't stay. But you better come up with that $2 somewhere, or else you can't stay. Ridiculous stuff. I mean, people don't realize what the on-the-ground realities of homelessness is. Everybody thinks, oh, it's being taken care of. You know, some things are kind of being taken care of, is the reality of it. I mean, when you get down into the dirty of it, there's a lot of people who are going without food and going without shelter and going without the other basics we need to live and that we should have here in the richest country in the world.